Hello, my name is Amanda Reyna and I'll be demonstrating how to do phlebotomy, which is my everyday job. So first you want to verify your patient's information. So will you please verify your name and date of birth?
Yes, it's Jesus Elias A. Ramirez, born 1999, December 15th.
Okay, and then once you know you have the correct patient, you want to hand sanitize and get everything ready for the blood draw. So we're going to get a wipe, a piece of gauze for after you draw the blood, and the needle. You attach the needle to a safety vacutainer. Put this on. Whenever you draw blood, you have to have the bevel up. So the way that we are able to look if the bevel is up on here is there's a black dot telling us where the bevel is. So we line it up with that. Put on some gloves. Sometimes during this time, I like to ask my patients if they have a preferred arm for blood draw or if they get nervous during blood draw, so that way we can make some adjustments. So I put the tourniquet on the patient, and you want to try and make it as tight as possible so the veins will pop out. You can ask them to squeeze a ball or pump their fist while you look for a vein. Here's a ball. So most people's anatomy has three important veins: a medial, a basilic, and a cephalic vein. The best one that I've seen is usually the middle vein. And so we're going to try and look at his veins right now. You want to prepare the site by wiping it down. And you don't want to rely on your sight of a vein, you want to rely on the feel. So sometimes I look away just to make sure that I can really feel the vein, that it's plump and will be a good vein for a blood draw. This is the area you want to focus on. You never want to go down too low because there's a lot of nerves in here and you don't want to hurt the patient. Once you find a vein, you can have your tube ready in the vacutainer. I'm going to tell my patient to relax during this time, their hand, because you don't want them pumping when the needle is inside the arm. And right now we have blood flow, and so you want to pop the tourniquet at this point. You shouldn't really have the tourniquet on more than a minute. And then once you take out the needle, you want to immediately cover it with a piece of gauze. Close this with the safety, and now it's locked, and throw away your needle into a sharps container. Please hold this for me. Now I'll be showing what we use for babies, older patients. We like to use a safety butterfly. It's a little bit smaller than the normal needle is. And this also makes it easier if you have multiple tubes that you need to have drawn. So same thing, you just want to get a vacutainer at the bottom. So you take the safety off because this needle already has a safety built in at the top. You will attach your vacutainer to the bottom. And get a wipe and gauze just like you did before. This needle is great actually not just for the older people or babies, but anybody who even has a thinner vein in their arm. So again, put the tourniquet on as tight as you possibly can go. Ask the patient to pump a couple of times. Wipe down the vein. And also sometimes I like to use the wipe as a direct pinpoint to where I want to go put the needle in, because sometimes you don't want to lose your spot after you've already cleaned the area. So you uncap at the top, You ask your patient to relax their hand, and then you just go in. Sometimes you might have to fish around for one. And then all you do is plug your tubes in at the bottom, and blood flow will start. Then you fold your gauze, put it on there. Can you hold this? After that, I like to put gauze or a Band-Aid, or sometimes just a simple tape over the gauze. And so that is it for blood draw. This is what I do every single day, and hopefully you learned something from this video. Thank you.